The complications of Turner syndrome include kidney abnormalities, recurrent urinary tract infections. The kidneys are usually malformed and they are located in wrong positions. There can be high blood pressure. There can be inflammation of the thyroid gland. They have higher than average risk for developing celiac disease. Allergic reactions to gluten is also found to be very high. There can be heart abnormalities and there can be obesity. So that was about Turner syndrome. Now let's see about Klinefelter syndrome. So Klinefelter syndrome is a condition that occurs in man who have an extra X chromosome. So this is also an X-linked disorder where it occurs in male clients due to the occurrence of an extra X chromosome. So ഇവരുടെ last chromosome നോക്കിയിട്ടുണ്ടെങ്കിൽ it will have XXY. XYക്ക് വരും XXY ആയിരിക്കും ഇവര്. The syndrome can affect different stages of physical, language and social development. So the classic features is enlarged breast. So gynecomastia ഉണ്ടാവും. They will have minimal manly characteristics like facial hairs and body hairs. So the symptoms include they are presented with infertility. They will be taller than other boys of their age. They will be fluffy. They will have lot of fat around the belly. At puberty, these children will have smaller testes and penis. There will be gynecomastia, less facial and body hair, and there will be reduced muscle tone. So these are the characteristic features of a male child with Klinefelter syndrome. The other features associated are narrower shoulders and wider hips, weaker bonds, decreased sexual interest, low energy. They may have learning and language problems. They will be quiet, shy and trouble fitting in. ഒരു ഗ്രൂപ്പിൻ്റെ അകത്ത് സോഷ്യലൈസ് ചെയ്യാനുള്ള കഴിവ് കുറവായിരിക്കും. Coming to the diagnosis, here the diagnosis is carried out through a genetic test, usually karyotyping. Treatment, there is no cure as this is a genetic condition, but treatments are available. So in order to carry out a successful treatment protocol, it is very important to diagnose this condition as early as possible. So when treatment is initiated in the very early stage, most of these children can lead a normal life. Treatment include replacement of the sexual hormone testosterone and breast reduction surgery so that they have normal features like a boy child. If needed, they are also supplemented with physical, speech, language and occupational therapy. So that was about the treatment of Klinefelter syndrome. Now coming to the next condition, which is known as Edwards syndrome. So Edwards syndrome, it is known as trisomy 18, which is a genetic disorder caused by an extra copy of chromosome 18. So trisomy 21 pole extra copy of chromosome 18 ഉണ്ടെങ്കിൽ ആ കണ്ടീഷന് പറയുന്നതാണ് Edwards syndrome. So in Edwards syndrome, most of the parts of the body are affected. These children are usually born smaller than other children. They have associated heart defects and the other features include small head, small jaw, clenched fist with overlapping fingers. Our fingers normally placed avilia. They will have overlapping fingers and they will have severe intellectual disability. So these are the classic features: small head, small jaw, clenched fist with overlapping fingers and severe intellectual disability. So usually most of the Edwards syndrome, they occurs due to problems when the reproductive cells they develop during early developmental phase. This condition is usually associated with maternal age. So usually maternal age കൂടും തോറും ഈ ഒരു ഡിസീസ് കണ്ടീഷൻ ഉണ്ടാവാനുള്ള സാധ്യത കൂടുതലാണ്. ആൻഡ് ഇറ്റ് ഇസ് ഓൾസോ ഇൻഹെറിറ്റഡ് ഫ്രം പേരൻസ്. So here you can see a baby with Edwards syndrome. Coming to the causes, as we said earlier, the major cause is an extra copy of chromosome 18. The other causes include genetic history, which is a rare chance. Usually this happens due to abnormal development during conception and results from an extra copy of chromosome 18. So Edwards syndrome, they affect both males and females, but compared to males, females are more prone to have Edwards syndrome. So the signs and symptoms include, they have specific characteristics as we discussed in the first slide. The other features include kidney malformations, structural heart defects at birth like VSD, ASD or a patent ductus arteriosus. There can be omphalocele, esophageal atresia, intellectual disability and developmental delays. There can be growth deficiency, feeding difficulties and breathing difficulties. Also there can be arthrogryposis, which is a muscle disorder that causes multiple joint contractures at birth. So joints contractures ഉണ്ടാവുന്ന ഒരു condition ആണ് arthrogryposis. So which is a muscle disorder that causes multiple joint contractures at birth. The other physical malformations include small head or microcephaly, low set and malformed ears, abnormally small jaw, which is known as micrognathia, cleft lip or cleft palate, upturned nose, narrow eye folds or palpebral fissures, widely spaced eyes or ocular hypertelorism, drooping of the upper eyelid or ptosis, a short breastbone, clenched hands, chorioid plexus cyst, underdeveloped thumbs or nails, absent radius, webbing of the second and the third toes, club foot or rocker bottom foot in males. You can also have undescended testicles. So these are the classic features of Edwards syndrome. Coming to the diagnosis, in utero, the most common characteristic is a baby found to have cardiac anomalies along with a CNS anomaly and the typical shape of the head. So when a detailed USG is done, you can also see intracranial anomaly, choroid plexus shift and pockets of fluid in the brain. So ഇത്രയും കാര്യങ്ങൾ in utero USG യിൽ നിങ്ങൾക്ക് കണ്ടുപിടിക്കാൻ പറ്റും. And when these features are found, the baby is supposed to have Edwards syndrome. ഇവിടെ ഉണ്ടാവുന്നത് cardiac anomalies, CNS anomalies in the brain like choroid plexus cyst with pockets of fluid in the brain. So we'll stop here. In the next class we'll be continuing with the other conditions associated with genetics. So hope you are clear. This class will be taken again by the externals. Please revise this portions. Thank you.